Hospital-acquired infections and associated illnesses are some of the most common yet easily avoidable complications that can happen during a patient's hospital stay. This video will share tips on preventing the spread of infection because it's a team effort in which all healthcare providers, volunteers, visitors, and patients play a pivotal role. Hand hygiene is the easiest and most effective way to prevent the spread of infection. Whenever a person touches an object or cares for another patient, germs can go along for the ride. Infections during hospital admission can prolong a patient's stay by 10 days or longer. We encourage everyone to wash their hands before entering and leaving the hospital. Alcohol-based hand rub is the preferred method of hand hygiene when hands are not visibly soiled. There are dispensers easily available for everyone to use. Apply 1 pump of alcohol-based hand rub to your open palm and rub together until your hands are dry. If your hands are visibly soiled, wash with soap and water. Soap dispensers are available at all sinks in the patient and visitor washrooms. Woodstock Hospital has a robust hand hygiene program which ensures that all healthcare workers are washing their hands before and after direct care. If you are unsure if a healthcare worker has washed their hands before providing your care, please ask them to do so. Woodstock Hospital has protocols in place when caring for symptomatic patients or patients who may be carrying germs that can spread to others. These patients are placed in a private room under isolation precautions. Isolation precaution signs tell the healthcare team which personal protective equipment, also known as PPE, to wear before entering the patient's room to prevent transmission and ensure the safety of staff, visitors, and other patients. If patients require isolation precautions, they and their visitors will be advised to follow specific instructions identified by their healthcare team. Sometimes bacteria can develop the ability to no longer be destroyed by antibiotics. When this happens, the bacteria or organisms are called resistant to antibiotics. These are what we call antibiotic-resistant organisms. These antibiotic-resistant organisms can live on hands and objects in the environment. Antibiotic-resistant organisms are spread by contact, so the best way to avoid spreading them is to practice good hand hygiene. Some examples of antibiotic-resistant organisms are MRSA, that lives on the skin, and VRE, that lives in the gut. An outbreak happens when the number of cases of hospital-acquired infections rises above the number normally occurring. During an outbreak, enhanced measures are implemented to limit the spread of infection and resolve the outbreak as soon as possible. This includes additional cleaning, additional PPE worn by the patient's healthcare team, and additional investigation and auditing by the infection control team to find and identify possible transmission sources to prevent future outbreaks. Patients on isolation precautions may be required to stay in their room. Additional lab testing will occur to identify any new cases. If the unit you are on is currently in outbreak, please talk to your healthcare provider and review the outbreak pamphlet, or you can ask to speak to an infection control professional. The housekeeping department is responsible for cleaning and disinfecting the hospital environment. Each staff member receives specialized training to ensure all hospital cleaning standards are met. As a hospital, we invest in innovative tools such as ultraviolet light and robotic floor scrubbers for enhanced cleaning and disinfection. Here are some additional guidelines to keep patients and visitors safe during their hospital stay. Only visit a patient if you are feeling well. If you are on isolation precautions, please ask your visitors to speak to your nurse for additional instructions. Limit the amount of personal items that you bring into the hospital. This allows us to reduce clutter and our housekeeping staff to clean your room properly. Wash your hands before touching a patient refrigerator or water machine. Store personal food and drinks in a cooler bag. Due to strict food regulations, personal food and drinks are not to be stored in any hospital refrigerators. Thank you for taking the time to learn about Woodstock Hospital's Infection Prevention and Control Program. For more information, please visit the Woodstock Hospital website or contact an infection control professional at 519-421-4211 extension 2449.